these stress fighting habits that happen to be anti-inflammatory. So we get to, when we talk about the stress disease link, right? Inflammation is the chain that ties stress to disease, ties our psychological experience of stress to physiologic stress, which shows up as inflammation in our bodies, and then chronic inflammation increases our risk of all these different chronic diseases that we'd rather not deal with. Things like high blood pressure and high cholesterol and type 2 diabetes that lead to heart attack, stroke. And, you know, in the text message this week, we also discussed how chronic inflammation increases our risk of cancer by down regulating one of our genes called P53, that's called the guardian of the genome. One of our genes that creates a protein that's responsible for making sure that our cells are repaired safely, and responsible for like going through and killing the cells or asking them to kill themselves if they have mutations in their DNA that could potentially lead to cancers, like uncontrolled growth. That's what a cancer is. And this particular gene is downregulated when our inflammatory markers increase. And it makes sense when we think about, I'll go back to this diagram, when we think about exactly what's going on when we experience stress in our brains and how it gets translated into stress in our bodies. We talk about stress as a way of telling our brains and bodies you're in danger, and then set off these pathways, the fight or flight response and inflammation, in order to start protecting ourselves from the danger. Except in this case, the danger isn't physical. And so we kind of don't need fight or flight to get ready to run. And we don't need inflammation to get ready to heal a wound. But these are the way that our bodies, these processes have been connected. And this is the way that our bodies have worked for millennia, probably. And so that's what we're dealing with. But when we've got inflammation coming from, you know, the most primordial point, coming from the point of our DNA inside the nucleus, and our inflammatory factors increase, the goal, the message sent to our body is, you're in danger, you got to protect yourself. And so all these other bodily processes that help us live long term, they get shut down. So we've said we have more trouble managing our blood sugar. We have more trouble managing our blood pressure. And then I just mentioned this gene that makes the protein that helps to stamp out early cancers or prevent early cancers from developing. That one gets downregulated. So we don't have that to rely on. And it makes sense, again, because inflammation is not supposed to last longer than 24 to 48 hours. So it's not the biggest deal if you have, you know, a few cells over 24 hours that that replicated with some errors in their DNA and some mutations, right? You can maybe go back and catch those problems once inflammation dies down and that P53 guardian of our genome is circulating again, is upregulated. You have higher blood pressure for a moment throughout the course of the day, and in the setting of, healthy interplay between our systems, that blood pressure is generally, it's not high enough to cause a bleed in the brain usually. It's just high enough to get blood pumping to the organs that really need it so we can run away, like our muscles and our heart, and lungs and brain, and kind of divert the blood away from organs that aren't as important right now. We're not so worried about what the kidneys are doing and what the liver is doing when we have to run from a physical threat and we're trying to save our lives. But then this stress disease link goes through the pathway of chronic inflammation, because all these things I just mentioned, the ways that our body is dysregulated with inflammation, it's okay in the short run, but in the long run, it becomes a really big problem. We can't spend weeks and months with chronic inflammation having our blood sugar way too high. We can't spend weeks and months with chronic inflammation having our blood pressure unregulated and way too high. We can't spend weeks and months having our cells that go through damage and have to be repaired, having our cells develop mutations without our usual system of checks and balances to stamp out those early cancers. But that is how psychological stress moves through chronic inflammation, triggers inflammation in our bodies. And if we cannot fight that inflammation, then it remains chronic. And then it triggers disease. Does that make sense to you all? I know this is some people's first time hearing the whole process, and we've kind of dragged it out over a few weeks to make sure we cover each piece. But is it all coming together now?
Yes.
Okay.
Yes.
Thank you. All right. And so I wanted to make sure we had that background as we talk about just where exactly we can intervene in breaking up the stress and disease chain. So the first place would be, let's make sure that we just don't have stress to begin with, right? What can we do psychologically? How can we shift our mindset so that we look at challenges and the challenges just aren't things that turn into stress, right? We're able to tackle the challenge. If we think it's something we can control, we use the 3 A's. So we ask, can I address this challenge? If it's a thing I can control, sure, I'm just going to tackle this. I'm not going to stress about it per se, just going to do what needs to be done. And then if we can't control it, then we just accept it and work around it. And that's where, Miss Maddie, this was a very long segue, but that's where I got so excited to hear you say, turn it over to God or give it up to God, because we've heard that phrase from so many older generations, from so many people in our own generation. It might even be a meme at this point, but it speaks to the generational wisdom of our ancestors who recognized the importance of being able to let go of would-be stressors that you can't do anything about. It's not something that we need to take on. I mean, it's like a beautiful mantra, turn it over to God, let it go. And then, when we talk about the 3rd A, giving ourselves some affirmation, I'm human, it's okay to have hard times, it's okay that I'm possibly feeling a little stressed, right? We don't have to pile stress on top of stress by fighting the feelings that we're having. it's okay that things didn't quite work out the way that I had planned or the way I wanted them to. And, you know, when we talk about our spiritual life, and the spiritual legacy of Black folks in America, the Black church, so much of that wisdom surrounds these principles, which have now been included in a number of scientific studies and psychological paradigms like cognitive behavioral therapy. Just figuring out when to let go, and then figuring out when to move on. Can anyone think of like, is there a phrase that you've heard that hits on this third point, this affirmation that I'm human and it's okay to have hard times? Does that resonate with anybody?
I don't know, when they said let go and let God, I don't know if it's this accept or the affirm. I'm not sure where that fits in. That's what came to mind when I, when I heard Miss Maddie, and then, you know, looking at this. Because I took a picture of this. Now I'm really excited because I'm doing the next slide. I'm doing a lot of those things. So I'm like really excited.
Yes, yes, yes. Okay, I would definitely want to hear about that. That is a very good point, right? So let go and let God is very much in the acceptance category. If I can't control it, I just work around it. I let it go. But it's also very much in the affirmation category. All right, whatever's going on, I'm gonna just let God deal with it. And so I especially want to emphasize the secular approach, because I know that some folks watching may not go to church or may not affiliate with the type of spiritual religion, the spiritual legacy that we're talking about. But these are really human principles that are excellent in supporting spiritual well-being. And so however you come to it, whether it's through, a Protestant, a Baptist, a Catholic approach, whether it's a non-religious approach, whether your therapist is helping you work through feelings and thinking through what exactly causes stress and why, these 3 A's might be a helpful reminder and a particularly useful way to just sort of nip that stress disease chain in the bud by blocking the creation of stress to begin with. So now Terry alluded to this next slide that we're bringing up here, which acts a little bit farther downstream. So we talked about in the last slide trying to block the creation of stress by sort of shifting our mindset. But what happens when that doesn't quite work and we still have stress and it turns into inflammation in our bodies? And we want to make sure that that inflammation doesn't persist for days, weeks, months, years as chronic inflammation. We want to cut that down. And there are a bunch of activities here on this slide that have been shown in studies to block inflammation at its source. So to reduce the inflammatory markers and also reduce some of the transcription factors, the ones that are responsible for printing off the inflammatory markers, printing off the signals that tell the body, oh, we're ramping up inflammation, we're doing it. And so if we can kind of handicap those transcription factors that are responsible for starting the cascade, well, then we're doing a really great job of cutting off the progression from acute inflammation to chronic inflammation that can cause disease. All right, so then what are these things on the page that you see you're already doing? We've got exercise, cardio and resistance, so weightlifting of some sort or body weight activities. We've got deep breathing exercises, and we have other meditative exercises like Tai Chi, or in particular, this slower form of yoga. And then, yes, research also shows that social activity, socializing with a tight-knit group that provides support, reduces levels of inflammation. Can you think of any of these things that you're already doing, you all?
I'm doing all four, but to a limited degree. For the physical exercise, I'm not necessarily, well, maybe with the 10,000 steps, but that's not really exerting. Uh, I'm not I'm not doing it like for a 20-minute period and, really going at it. But the deep breathing exercise, the meditative exercise that I have on the phone on Tuesdays and Thursday mornings, they focus on breathing exercises. And then you taught me how to breathe, as well as yoga, because I said, I don't breathe like that. So you guys had to sit and teach me how to do this. So I've been focusing on my breathing. And then my sister and I, we're close. So that can be the tight knit social group.
Oh, that's so beautiful. I remember you told me you and your sister, did you say that you sometimes walk together or you sometimes do some sort of exercises together on the phone? Or am I
On the
misremembering?
phone. Yeah, it would have to be on the phone because she's in Jackson, Mississippi. We're not in the same place. Yeah.
So yeah, I mean, that's great. You are hitting each of these four categories then. I remember you talking about yoga. Yes, we did the deep breathing exercises where we talked about belly breathing. So
Mhm,
it's just like a potpourri of
mhm.
opportunities here that any of us can dive into. You're getting your 10,000 steps counts as activity. And remember, we talked about how myokines, anti-inflammatory myokines, those muscle hormones, are released from muscles, particularly when we move them. So just walking anywhere might release myokines. Just getting 10,000 steps in as opposed to 1,000 where we were sitting for most of the day, right? That can have an anti-inflammatory effect. If we really wanted to supercharge that effect, then maybe we think about how, and I don't know if studies have examined this specifically, but here's what the science tells us so far about myokines. We think about how they have a dose-dependent response to exercise. So higher intensity is going to release more myokines into our blood, and then higher uh, length of activity, so longer duration of activity, is going to release more myokines. So if you had the opportunity, it might be more beneficial to your health to do a 20-minute or a 30-minute bout of walking, getting those steps in, as opposed to only doing the background activity. But whatever works for you, whatever fits into your life right now that you can maintain, let's do that. Because this is so much, wellness is so much about balance and finding ways to sustain the life-giving activities that we're participating in.